Tonight, fact or fiction, we investigate whether a homeless man could have possibly tailgated on isolating travellers for a five-star 2-week getaway. And the government's funding an overstretched AJ Hackett bungee to the tune of $10 million. But first, we have one new case of COVID-19 today. A woman who returned home on an Air India flight and was in isolation at Auckland's Pullman hotel. That means there's now a total of 11 active cases, at least 7 of those are people who've arrived from India. The Health Minister yesterday announced beefed up COVID protocols at the border, including testing customs workers, immigration and aviation security, and international air and maritime crews. So how is that all going to work? Well, the Health Minister, David Clark, joins us now. Good evening, Minister. Before we move on to border testing, I just want to start with today's developments. 51 out of 54 people who left isolation early were not tested for COVID-19. What responsibility do you take for that?
Good evening, Lisa. Overall, I do want to acknowledge that our procedures have worked, but this is an area where they clearly were not followed. And so I have, of course, along with other ministers, expressed incredible frustration on behalf of New Zealanders that this hasn't worked as we had expected it to.
But whose responsibility is that?
If I could finish answer the question, the Director General has accepted responsibility on behalf of the system and is setting about fixing it.
So, do you then take no responsibility as Health Minister for this?
Well, I think as the Prime Minister's outlined in Parliament yesterday, there were separate assurances that the system was in place, that people were being tested.
But I'm asking you, the Health Minister, do you take any responsibility for this mistake?
Well, look, I take responsibility for fixing it.
At Dr. Bloomfield's feet?
This clearly is an operational error, and that has been acknowledged. Dr. Bloomfield has taken responsibility for it and is setting about fixing it. I, of course, want assurances that that is on track, and at this stage I can see that the Ministry is indeed getting on and fixing the problem.
So can you just give me a clear yes or no on this? Do you take no responsibility for this at all?
The responsibility for this sits at an operational level.
So that's a no.
I found the system.
So that's a no.
I found the system was not working. I suspended any compassionate exemptions. Immediately I found that system was not working as ministers were led to believe it was.
Why can't you just state that simply? You don't take any responsibility. That's what you're telling me, isn't it?
Well, Lisa, I have responsibility for sorting it out.
Okay, so I'm just wondering, how's your relationship with the Director General of Health, seen as this has all been lumped at his feet as his responsibility and his mistake? How are you going with your relationship?
Well, I think we have a very good working relationship. I think New Zealanders as a whole,
as it was, Minister?
Yes, and I think New Zealanders as a whole would acknowledge that Dr. Bloomfield has played an incredibly important role in the position New Zealand finds itself in the world as the envy of most other countries being COVID-free. And that has had a lot to do with Dr. Bloomfield being a public health specialist who has played a pivotal role in New Zealand eliminating community spread of COVID-19, something that most other countries in the world would like to achieve.
Have you thrown them under the bus on this one?
Dr. Bloomfield has accepted responsibility for it and is fixing it, and that is the thing that I think matters to most New Zealanders, that we actually don't have these problems happening again. We want to stay COVID-free because people have made sacrifices to get here.
We've had a number of cases in recent days, people arriving on Air India flights. So I'm wondering, what assurances can you give us around international crews? There was an Air India flight today. So did that crew get tested at all, or where did they go after the plane landed?
Those crews go into self-isolation if they're overnighting here, and otherwise, I mean, with international flights, either people immediately return back overseas or they're required to go into self-isolation here. Very similar to New Zealand crews who are travelling in New Zealand, for example, to LA or San Francisco. They have a strict regime making sure that they are in managed or self-isolation during their stay.
At the same hotels that other people are isolating at, or do they choose their own hotels?
They are taken in separate transport. There is a protocol around making sure that they don't come into contact with other people.
So are they going to different isolation hotels than the government is using?
I don't have the detail of which hotels they're using. I could find that out for you, Lisa.
So who keeps an eye on them to make sure they play by the rules?
There's an expectation that they are, of course, because it's a privilege to come to New Zealand and to operate here. It is actually something I have asked officials at the Ministry of Health to give me further assurance around. There's no suggestion that they're not. I have not received any reports that they're not. But again, we're looking at ways to provide additional insurance because we want to make sure that our border is rock solid. We're in this privileged position in the world, and we want to stay there.
So will they be subject to COVID tests? Those international crews?
They are international folk who are here. They're not New Zealand citizens who we can compel in that way unless we believe that they present a genuine public health risk to us.
So by law you can't test them?
Well, unless they present my understanding is unless they present a public health risk, that we're trying to ensure very clearly that they don't.
So when you say that aircrew will be tested, you're referring only to New Zealand citizens, Air New Zealand staff?
Yeah, those who are resident in New Zealand. We don't want people going into the community without who are going to high-risk destinations overseas. Let's not forget just how rampant COVID is. It's spreading at the fastest rate overseas in many countries than it has at any stage. We don't want those people coming back and going into our communities without first having a period of a couple of days to see if any symptoms develop and then having a negative test. So it's a tightening of the regime. Of course, on those flights and when they're overseas, they've got very strict protocols around PPE use, around remaining in their hotels when they're there. So, we don't think there is a risk, but we just want that extra assurance.
But given there has been quite a few cases arriving back from India, are you concerned at all about Air India crew?
Well, I think India as a whole has got a growing number of COVID cases. We can expect more New Zealanders to be coming back with COVID. That's the reality. These New Zealanders are New Zealand citizens who have a right to come back to New Zealand, their home, but we have to take precautions, and we are continuing to
So will you ask the crew if they would volunteer for a test? Are you going to do that, to ask air crews from other countries whether they will voluntarily take a test?
Look, it's certainly as a part of the assurance piece around these flights from overseas crews, something that I'm talking about with the Ministry.
How many, you said these were effective immediately, these announcements that you made last night, so how many aircrew have been tested as a result of the new rules?
Aircrew have actually, the regime's actually been in place, was in place last week, is what I've been advised. So the crew are being put into they're expected to self-isolate and then be tested, return a negative result before they return to the community. Of course, the first line of defence is making sure people don't get sick, and that is through the appropriate PPE use. And we've got no evidence of people having picked anything up on the flights, those crew, but this is an extra assurance that we're putting in place.
Minister, I know you've got to go, but very quickly, are masks going to be compulsory on flights, international flights?
We have, the Director General of Health has written to all airlines requesting that they supply a pack with masks in it and possibly other PPE for every person who flies, that they demonstrate how to use it and that there be a clear expectation that people use it. There's no, of course, there's no legal basis internationally, but then what I would say is that if everyone has it in front of them and demonstration of how to use it properly, I expect people will use it to keep themselves safe and those who are around them safe.
So it's not compulsory by law?
The other thing I would add is that when people do arrive here and they're going into managed isolation facilities, they are New Zealanders who have a responsibility to play their part, and those who go into managed isolation facilities are those who are considered low risk. Those who are demonstrating they're not willing to play their part are much more likely to end up in quarantine facilities where there is going to be closer monitoring.
Thanks for joining us this evening. That is the Health Minister, David Clark.